Hello everyone, now and many years in the future. My name is Jawahar Malhotra, and I'm going to be doing an interview with one of the eminent cardiologists from the Houston area, Dr. Randeep Suneja. This is an ongoing series of interviews that we're doing for the Foundation for India Studies program, the oral history project that they have, which is being conducted in conjunction with the Houston Public Library. And today, Dr. Suneja, we'll have a chance to learn more about you. Welcome to the Foundation's project.
Thank you, thank you. I really feel very privileged and honored to be part of the Foundation for India Studies Oral History project, and would love to share my history.
Sure, of course. Without, on that note, you've been in the Houston area for many, many years. How many years have you been here?
I moved to the Houston area in July of 1992.
I see. And you came from?
I finished my cardiology and interventional cardiology fellowship at Case Western Reserve University in Cleveland, Ohio, and moved here as a practicing cardiologist, worked for a year, and then thereafter I started my own practice.
But I meant, where are you from? You're originally India?
Yeah, originally I'm from New Delhi, India. Grew up in Karol Bagh, the busy Ajmal Khan Road area, and grew up with my family. I have one brother, and my parents grew up in New Delhi, India, and did my entire schooling and my medical school in New Delhi.
Right, so Karol Bagh is of course a very popular destination now, and it has been always, but it's a very busy area now. But when you were growing up, you had an epiphany, something that happened to you in your 8th grade that drove you into this profession. Share that with us.
Yeah. So as a young child, I was academically very strong, and the desire for learning was driven by my mom, who had a tremendous drive for education, and her impact on both her children, my brother, who also ended up becoming an ENT surgeon, and I also, as a young child, had a tremendous desire to learn. And in the 5th grade, I had the desire to be a physician. And in 8th grade, I still remember my teacher's name, Dr. Singh. We had a project where we had to do a study on the heart. And I was just totally fascinated. And I remember borrowing my brother's books and drawing these diagrams of the heart, and totally fascinated by heart. And I knew that day that one day I want to be a cardiologist.
Is that right? So you shared that with your family, and what did they say at that time?
They were always ecstatic, and I was academically a very good student at Salma Public School, and obviously then decided to choose science, but they were very, very happy. And
but now you did this at the expense of sports. You didn't excel in sports, did you?
No, unfortunately, I was extremely poor in athletics, and I never participated, except the hobbies that I had were nothing related to reals, in the form of kite flying and doing things like in the streets of Karol Bagh playing gulli danda and playing pittu, and
yeah, these are the typical things that Punjabi boys do when they're growing up in Punjab. But the surprising thing is that you actually ran in the marathon here in Houston. Now, many years later, that's almost 40 years later, you did this.
Yeah, that's absolutely correct. I, as a practicing cardiologist, we obviously emphasize healthy lifestyles and exercise. And in 2002, I took the challenge of preparing for a half marathon in Houston. And I did that in 2 hours and 12 minutes with comparatively less training. And then I had a long hiatus. Just life has been very busy, as you know, as a practicing cardiologist. But then in the last 1 year, I have ran 3 half marathons. One, in fact, an impromptu half marathon in New Delhi, India.
That was last year.
That was last year. That's correct.
That's when New Delhi had its first marathon, was it?
No, it was actually the 10th half marathon.
Okay, all right, yes. And you were written up. You had your there was an article about you in the newspapers, and then it was you actually went there, as I remember, because I remember writing the article, But you arrived the night before, and the next day you went and got registered for the marathon, which you did not know was happening at that time.
That is true. In fact, I have to correct that a little bit. I had gone to attend the first World Hindu Congress to attend it and learn about the World Hindu Congress. And as I was reading the newspaper the next day, I found that there was a half marathon happening in New Delhi, and I was obviously had not registered, and subsequently I called up some my friends here in Houston, and through some connections had made an entry into the marathon. I had arrived in Delhi about 2 days prior, so it was, but still I had not, I was not really prepared. But I always carry jogging shoes and running gear, so that if I have to run, I would love to do
so
that.
So that you were jet lagged, and in spite of that you were able to do it. So that's quite a remarkable turn from the little kid who didn't like to do sports, right?
That's true, that's true. And I think that I have to give the credit to my wife, Seema, who was very athletic in her childhood. So I think over the years you rub off on each other and you learn from each other, and I'm sure that certainly has had a very positive influence.
So let's get back to your education a little bit, because you went to school in Delhi, and then you went to the Hindu college, right?
That's
in Delhi.
right, yeah.
And where did you do, I guess it's the MBBS at that time?
Yeah, so MBBS, I did my schooling at Salman Public School, which is one of the good schools at there, and academically I was doing very well in school. I ended up being a school prefect, a junior prefect, and I was house captain. And in high school, at that time, our admissions to medicine used to be based on your subjects of physics, chemistry, and biology. And in 1977, when I graduated, I had the number 5th highest score in the entire India, with 96.5% in physics, chemistry, and biology, ending up at one of the top pre-med programs in the country, which used to be Hindu College, with the top 20 kids go to do pre-med at Hindu College.
And I see. So now, didn't you go then subsequently to the Mulan Azad Medical College?
That's true, yeah. So after finishing your pre-med, I entered Mulan Azad Medical College. I was trying to get into All India Institute, which is obviously the #1 institute, but Mulan Azad, who is currently and has been the #2 medical school in India, an excellent school. And I had scholarship during the Mulan Azad Medical College and finished my medical school in 1983.
And by the way, you have been instrumental in the Mulan Azad Medical College Alumni Association of North America, right?
That is true, that is true. I currently am the president of MEMCOANA, and in fact we are having our reunion here next month, and we have really brought up the organization, which is the 31st reunion happening, but we have accomplished a lot, bringing the alma mater closer to the MEMCOANA, and in fact in November I was the first individual from the US to give the guest lecture series at Mulan Azad Medical College, after having met with the Dean, Dr. Thempe, and we are having a very close association of medical school with the MEMCOANA.
But this is the second time that's happening in Houston. This next month in July, it'll be here, and 2 years ago it was here.
That is true. 3 years ago, in 2012 also, me and my wife, Seema, we were the hosts for the MEMCOANA, and that was the first time MEMCOANA was ever held in Houston.
Now, getting back to your education, something very remarkable happened to you when you got your degree. And let me show the audience what that was. Here you are getting your degree, your graduation certificate from Mother Teresa.
That truly was a moment of a lifetime. It was actually the entire graduating classes was very, very fortunate, because it was our college's 25th anniversary, and they wanted a special guest for the graduation to give the graduation certificates, and the entire graduating class of 180 students was fortunate to receive to get our medical diploma from Mother Teresa. And I distinctly remember that moment with my family attending, and Mother Teresa giving the convocation address.
Look at this. This is quite a remarkable young doctor, not yet a full doctor, but so this was which year?
This was, I finished the medical school in December of 1983, and the ceremony took place in March 24, 1984.
I see.
And it truly was a moment of a lifetime where the entire graduating class took the Hippocratic Oath with Mother Teresa, and I truly believe those blessings, as you know, blessings from God and parents and family and friends play a very, very major role, which I have a very strong belief in during my practice of medicine. And the entire graduating class was very, very fortunate, and I was on top of it fortunate enough to also receive the gold medal from President Zail Singh, as I was had a gold medal in surgery. So we were a very, very special batch, and we were extremely fortunate to take our Hippocratic Oath with Mother Teresa.
But when you took your ECFMG exam, you went to Lahore, Pakistan, to take the exam, because that was the nearest center you could take that at that time. And then you came to the US. When you came to Houston, tell the audience about that. The first year you said you could not find a job as a doctor or a medical, in any medical line.
And that's true. I went and did my ECFMG examination and the FMGM examination. I went to Lahore. At that time, I wanted to come to the US, and it was easier if you had finished your exams ahead of time. So I did my ECFMG and FMGMs in going to Lahore, and did very well in those, and subsequently came to the US. I arrived in the US on July 20th, 1985, and it's approximately a one-year process where you have to start applying for your residency. Application takes about a year or so. So in the interim, I had the fortune of doing an externship with one Dr. Mehta here in Houston, but I could not find any job in a doctor's office. I knocked on a lot of doors and somehow could not find. I was so desperate to work in any capacity in a physician's office while I was getting my application ready for the residency. But unfortunately, I just not could find. But obviously, I did not want to be sitting home, so I ended up doing all kinds of odd jobs, including working in malls. I still remember there was a place, World Bazaar, Palais Royal, and I distinctly remember earning $3.35 per hour, which was the minimum wage at that time.
Remarkable. When you think about it.
It's a good learning experience, and worked for an entire year in these low-paying jobs. I had one job where I was working as a tutor, which used to pay about $15 an hour, and I had to study math and science the night before to teach the high school kids, because I had not studied math and science, high school science, for a long time. So it was very fascinating, but it ended up, the year went by very fast, and I started my residency in July of 1986 at one of my top choices. I interviewed at about 26 places and received the residency at SUNY Downstate in Brooklyn, which was my first choice, in Brooklyn, New York.
Wow, wonderful. So then, after you did that, you came back to Houston, yes?
No, after finishing my residency in Brooklyn, I knew I wanted to be a cardiologist. So during my residency, I actually, in my entire month of vacation, I distinctly remember in my internship, you get 1 month of vacation. Since getting into cardiology was my aim, and it was extremely tough as a foreign medical graduate to get into cardiology fellowship, I sacrificed my entire month of vacation at SUNY Downstate, Brooklyn, and worked in a research project for 1 month. And that was actually played a very, very important role, because the research project that I did, I still remember, with Dr. Nabil Al-Sharif, who was the chief of cardiology, got me an article, a manuscript published. And also I did another project, a research project during my year, and presented a paper at American College of Physicians meeting in Cooperstown, New York. So because the fact that getting into cardiology fellowship was very, very hard, which I was very determined to get, these research projects helped me get interviews for fellowship, and ended up doing a fellowship at Case Western Reserve University in Cleveland, Ohio, which I did from 1989 to 1992. That also included 1 year of intervention fellowship, which was the beginning of the coronary interventions that were starting at that time, and that I was the second batch to do a coronary angioplasty fellowship, and finished in 1992, and then came to Houston in July of 1992.
So when you came to Houston, then you had an intention of starting up your practice here, but you worked for some time with some other practice, right?
That is correct. At that time, I could find a job in Pasadena, and I worked for a cardiologist in Pasadena for a year, and then had made up my mind that I would like to start a private practice. And in July of 1993, I started the practice with literally 0 patients, and took a $75,000 loan, and said that I'm going to practice cardiology in west part of town, and started my first office at West Houston Medical Center with no income guarantees, nothing, and just took a loan and my faith and belief and the skills, and I said I want to start my cardiology practice.
And now this is, what is it, almost 20 years later?
22 years.
22 years later.
23 years.
And you've now seen over 50,000 patients.
Actually, I have seen over 58,000 patients in my practice. I practice practically almost as a solo practitioner, with a few associates who came and went for a couple of short periods of time, but essentially practice as a solo cardiologist for over 20 years. In 2006, I moved from Houston to the suburb of Katy, where I built my own state-of-the-art 10,000 square foot facility.
But Katy is not exactly a suburb anymore. And 15 years later, after that, Katy is almost an extension of Houston.
That is true.
And in fact, here I'm going to show another award that you received at that time before you moved to Katy. Here's one from Houston Magazine, and it shows you in there as being one of the prominently recognized physicians of that time. This is from September 2005.
That was one of my first awards from Houston Top Docs that I received. It was a great moment, and subsequently I have been very, very blessed to receive numerous awards, but clearly that was one of the biggest awards that I received until since then.
Yeah. Well, we'll talk more about the other awards, but this was a nice piece that was done on you. You must have been quite surprised.
It was an honor, a big honor, absolutely.
Wonderful. So tell us more now. When you moved to Katy, you ended up having you built your own building, and
yeah.
you started seeing more and more patients, and then in Katy. Since 2005 to 2015, in 10 years, Katy has really welcomed you as one of their prominent citizens.
That is true, that is true. I have been involved in taking care of patients from Katy even prior to moving to Katy, and that was a decision to move to Katy, as I saw that more than 2/3 of my patient population was coming from Katy. That prompted me to move full-time to Katy. And I had been involved in local work in the Katy, city of Katy and the community of Katy. I was the president of the American Heart Association from 2000 to 2002, and the American Heart Association, the Katy chapter. We took the chapter from a very from basics to we took the chapter to a very elaborate level. In 2000, from 2002 to 2004, I was the chairman of the American Heart Association Katy chapter, and we were very successful in raising lots of funds for the American Heart Association. And in 2006, I was very, very blessed and fortunate to receive the award from the American Heart Association.
Yes, I remember that occasion very well. Now, recently, you've received another award. This one is for the Best Cardiac Surgeon for 2014 from Katy Reader's Choice, Living Best of Katie, the Reader's Choice.
Well, I have truly been blessed in receiving numerous awards from Best of Katy to Best of Houston, from leading physicians of the world.
And here's another one from the Katy Area Chamber of Commerce.
This truly was a very, very special that I received in February of this year, when I distinctly remember in January receiving a call from Ann Hodge, the president of Katy Chamber, that they had chosen me to be the Citizen of the Year. And truly, I was very, very humbled and very, very honored, because when Anne called me, she said that I was the first non-Caucasian to receive the award in the 48-year history of the Katy Chamber of Commerce, and I was the first physician to receive that award.
Right, and in fact, they honored you at the gala that was held, the 2015 gala that was held at, where was this held?
And that's Safari Ranch.
Safari Ranch, and here's a big write-up about you in the gala itself. So this was just last year?
This was this year. This was in this year, in February of this year.
February of this year.
So this was truly another very, very big honor, very humbling to receive this award. Yes.
And of course, Katy really loves you, because here's another 2015 top cardiologist from the Patient Review Top Doctor from Katy. So it's quite obvious, Dr. Suneja, that both Katy and Houston, it's hard to tell the difference anymore, they really love you and they believe in your capabilities. You've been, just recently you went through your boards again every 10 years. Tell us a little bit about that.
Well, I was actually, I was the first quadruple board certified cardiologist in Katy, and academically I've always loved reading, and not only just reading, but I have always practiced medicine with a passion, and we in our practice, all our employees, they believe in our motto, which I had registered more than 15 years ago. Our practice motto is caring for your heart from our heart. And about a decade ago, I also registered a slogan, I treat, he cures, because we truly believe that we seek God's blessings in taking care of our patients. So we have been very, very blessed, and we work as an entire team taking care of patients, and I've been very, very blessed to have two excellent associates who joined me in the last 2 years, Dr. Pai and Dr. Desikan, who have helped me grow my practice, and we have seen over 60,000 patients now in our practice, and still growing by leaps and bounds.
And of course, you're well known in the community for your generosity in helping people who need the treatment, who need some additional analysis, diagnosis, and people recognize that streak in you. But it comes also from your belief in, as you just mentioned, in Hinduism, and you've gone ahead and started a non-profit organization, right?
That is correct. Just late last year, just to go back, in my childhood, I grew up in an Arya Samaji family, and obviously my dad had a very big influence on me in my learning my leadership skills. He was a secretary of Arya Samaj Krolbach for over 25 years, and my mom has this tremendous desire for learning, and the drive for education, truly believe in both of us, has come from our mom. And growing up, I grew up learning Havan and mantra, and have a very, very strong faith in Gayatri mantra. And I have such a strong belief that ever since I have started my very first procedure in the cardiac catheterization lab, even starting as a fellow, I have always done the job of Gayatri mantra before doing any procedure. Ever since to this day, I do the Gayatri mantra before doing procedure and giving the local anesthetic to the patient.
Is that right?
Absolutely. And my staff in my cardiac catheterization lab knows that I do a small prayer on every patient. And in fact, I share it with my patients. We have Gayatri Mantra very clearly displayed in our clinic. And the faith in Gayatri Mantra and what it has given, I also give a lot of credit of my success to not only blessings from God and family and friends, and obviously the love and support of the wife Seema and the kids and everybody, but Gayatri Mantra has played a very, very big role in my life, and that has driven me to create a non-profit that I created called Gayatri Mantra Global Foundation, which and I'm planning to take it to an international level. We're creating International Day of Gayatri Mantra, which in fact I will be speaking at the RS Maj Mahasammelan next month.
That's wonderful. So now your intention, you just started this foundation this year.
This is very recently. It was founded in November of last year, but truly speaking, I have just created the website, and we are going to take the website to a next level. And next month, for this month, it was very amazing that I received not only passed my cardiology boards in the top 5%, but then received the invitation to speak here at the Oral History Project. I also got an invitation to be a speaker at the RS Maj Mahasammelan.
And Wikipedia gave you an honor too.
That's true. Just this past week, the editorial board of Wikipedia contacted me, and they want to put a page of in Wikipedia on me. And I really just feel very, very blessed and honored to have all these things falling in place without making an effort to. I truly, truly believe that blessings of our elders, and truly believe blessings of my patients also, which I receive day in and day out, people bringing gifts for my kids and making things. On just Friday, I had a patient who brought in pohe, and I brought it home, and my wife said, Seema said, make sure you go and tell him this is the best pohe I ever had. we get so many blessings from our patients, and I truly, truly believe that in medicine, you have to practice with a passion, and truly, even in spite of the changing environment in medicine, in our practice, and this is the philosophy which I believe in, and all our employees believe in that we take care of our patients like our family and do anything, whatever it can be done to help our patients.
Now, let's segue a little bit away from medicine for a minute with your other interests. You've been involved with many organizations here in the Houston area. Talk a little bit about that.
Yes, I have been in 2000. I was involved with the American Heart Association. I was very actively involved for about 4 years as a president and as a chairman. And then I remember in the year 2005, when the India House project was being launched, Dr. Mathur, Mr. Agrawal and Mr. Ashok Dhingra we were sitting down together, and we were just brainstorming, and I still distinctly remember there was a
now, excuse me, I'll interrupt you for a minute. For those people in the future who do not know what we're talking about, India House is the community hub for us here right now. It's on the southwest side of Houston.
That is true. So in 2005, although the project dates back to almost 30 years, but it was coming to fruition in the year 2005, and I was very fortunate to be on the board of directors and the first joint secretary of the India House in 2005, and the project has flourished. I have been involved in other projects in Houston, worked with the Houston Habitat for Humanity, worked in the American Heart Association raising funds, worked and as running marathons, raise money for some local charities. We help patients in the Indian Doctors Club, Indian Doctors Clinic here. We see patients for them. We see patients for Christ Clinic in Katy. And we provide services, medical services to the needy, in addition to providing patients care to our patients.
But now this is keeping you very busy, isn't it? You're running around all the time. I remember seeing you going from one place to the other, and at the same time you have 5 wonderful children?
Yes, that is true. I have 3 older kids who, one is Nikhil, who is working for an IT company in Houston. Amit, my son, who has followed medicine, is doing medical school at Columbia. And daughter Divya is finishing Latin American studies at UT Austin. And we have wonderful 7.5-year-old twins, Nisha and Shivani. And Seema and myself are very involved. In fact, they go to the village school, and we are very, very involved in village school. Seema is very involved in village school. I am now working with the head of the village school, Mistro, and we are bringing Bollywood to village school, and we're doing a lot of additional things, bringing mentorship with my experience as being a mentor, a PACE mentor. I've been a PACE mentor, which is a program for academically excellent students from the KTISD. We are bringing those projects to village school. So I've been involved in a few things.
Yes, that's wonderful, and everyone here in Houston is so proud of you and for being such a well-known personality in the medical area, but also in supporting the community in so many ways. So now let's segue slightly differently about since you're so involved, obviously, in the treatment of hearts, with your heart. So what have you seen, what kind of changes do you see coming in the future for treatment of patients that have heart disease?
Well, you know, when I finished my fellowship in 1992, at that time we actually did not even have stents. The stents were introduced in 1994 and completely revolutionized the treatment of cardiology. And that was a very, very big change that occurred in taking care of patients. And instead of just doing an angioplasty, we put in a stent and subsequently maintain those arteries open. And we have seen some very, very amazing revolutionary things happen in the field of cardiology. We had the introduction of the drug-eluting stents in the year 2005, when the stents became coated with drug-eluting stents, and that reduced the chances of restenosis or scar tissue at the site of the stents. We have, in the last decade, we have also seen excellent new medications that have come for management of atrial fibrillation, which are blood thinners replacing the coumarin. We see a lot of changes in medicine, but one of the biggest things that has struck me is the preventive care, where we are now utilizing calcium scores for detecting preclinical coronary artery disease or heart disease, which has been an amazing technology.
So are some of these tests and procedures done in your practice?
Yes. We in our practice, we perform the echocardiograms or the ultrasound, the nuclear stress tests. We perform PET scans now. In the last couple of months, we've started introducing the PET scans. But calcium scores are conducted at the hospital, but we do venous ultrasound, we do other procedures. But the calcium scores are CAT scans which are performed in the hospital.
So right now we're at 2015. In 30 years from now, 2045, what do you see would be the status of treating heart disease? Do you think that could be done without any surgery?
Well, percutaneously, yes, the non-invasive management is continuing to increase as time is going by. We have seen from performing coronary angioplasty and stents to percutaneous replacements of aortic valves, which has already happened, and now at the Medical Center in Methodist, the trials for percutaneous replacement of mitral valves have also started. So we are seeing clearly percutaneous technologies gaining more momentum. For open heart surgeries or coronary bypass graft surgeries being conducted through smaller incisions. So percutaneous technologies clearly are growing in field.
So percutaneous technology meaning robotic technology?
Robotic or small incisions, and instead of doing large incision, everything utilizing Da Vinci robots and other technology. But these are surgical techniques. But in the field of cardiology, I think angioplasty, stents, and the medicines and preventive care with the use of aspirin and statins have played a very role. And in fact, just last week on Sunday, I love reading the New York Times every Sunday edition, and last Sunday there was this large article how the incidence of heart disease and heart attacks has diminished in the last several decades because of the preventive care, increased awareness of the patient population for taking care of themselves, taking good control of cholesterol by taking statin drugs, or getting screening techniques at an earlier stage. But we are very, very afraid that we are potentially going to be seeing some reversal, as we are very, very concerned about the incidence of obesity, which is continuing to rise, especially in the Hispanic population. It is a very, very big concern.
What about the Indian population, since you mentioned that? Is the incidence of heart disease and diabetes, is this all rising within our community?
We see a tremendous amount of coronary artery disease in the Indian community, and we offer them the treatments for detecting preclinical heart disease, because unfortunately many times the diagnosis is made after the heart attack. But we definitely see increased incidence. But I believe that it is the way we are living, the increased stressful situation, increased incidence of diabetes, lack of exercise, increased obesity, all these factors playing a role in causing increased incidence of heart disease, especially in whether it's in the Indian population or Hispanic population. The curves are rising at a very rapid rate.
Right, and the diet for both these kind of demographics, these populations, is very similar, is it not? There's a lot of carbohydrates, a lot of cheese, and so on, wouldn't you say?
That's absolutely correct. Yeah, increased intake of saturated fats and lack of exercise. These are the two very, very important factors that play a role. And then they lead to obesity, which then leads to diabetes and hypertension, and leading to hyperlipidemia, and all these becoming risk factors for coronary artery disease end up resulting in coronary artery disease or heart disease.
So you're stressing the importance of exercise in overcoming heart disease.
That is true, absolutely. Overcoming heart disease and detecting, and early detection is very, very important, and then getting the right appropriate treatments with the right physicians, and then continuing the medical therapies that prevent future heart attacks. I was very, very fortunate that in 2008 I presented a paper on the ongoing use of Plavix, or clopidogrel at that time was considered Plavix, which
Plavix is used for?
It is a blood thinner that is utilized after patients have had angioplasty and stents or bypass surgeries. And I had presented a landmark article and presented a paper at the World Congress of Cardiology in Argentina, where I submitted one of the longest database of ongoing use of clopidogrel, and found that a continued use prevented future heart attacks and strokes and death. So if you are taking good care of yourself by taking the right medicine, undergoing good care, you really can prevent future heart attacks and live a very long life.
Correct. So your advice to people, even now and many years from now, would be to get treatment fast, get regular checkups, do exercise, and watch your diet.
Absolutely, absolutely. And then I in my practice, I truly see the effect of stress, what it is impacting. We see so much young patients with hypertension and subsequently with obesity, hyperlipidemia. I have emphasized the role of yoga and meditation in practice. And we actually, when I give instructions to the patients, I in fact, even for a moment, I will teach them what pranayam is, and write them that they should do pranayam and yoga and meditation. And I do that myself, and I tell my patients that whatever I'm preaching, I'm practicing myself, because truly these are very, very important things that will play a very important role in prevention of heart disease.
So what do you see as the direction for your practice now? Knowing what you just mentioned and the direction that treatment goes, how do you see your practice going?
Well, with my new two partners going on, I'm doing less hospital work, but continuing to do office work and continuing to do procedures. Medicine is going through a very dynamic change, increased interference from the federal government, making us do all the, to some degree, unnecessary computer work, which is in fact taking away from the patient care. I feel sad that we are spending more time on computers and less on patient interaction, and it is a major concern because I see the enthusiasm in physicians getting less as we are overwhelmed with the amount of data that we have to complete and report it to the federal authorities, and it's becoming very, very time consuming, taking away our time from taking care of our patients. And obviously some major concern for some young bright minds entering into medicine because they see these concerns for the upcoming generation.
Correct, but as a result of these changes, your office has actually become paperless.
We have actually had electronic health records for almost 7.5, 8 years, and last year we switched to a new software. But in spite of doing paperless, we still have so much things that we have to complete to report to the government, to the insurance companies, the interference from the insurance company. It is to some degree to doing procedures, we have to get authorizations and adding more employees. It has becomes a very time-consuming job to get all these things done.
Do you have any patients who come from overseas, from India, for example, or vice versa? Do you see yourself doing any procedures or spending time training and mentoring people in India?
Well, the mentoring, I have just started the teaching program with Mulan Azad Medical College and going back to the medical school. It is, at this point of time, I have not done any procedures outside of India, but I see exchange of education as definitely very important. At this point of time, I have not thought of that.
But you have patients that come from overseas for treatment?
I have patients, believe it or not, who live in Dubai and live in Saudi Arabia and come once a year, twice a year from out 100 miles away from our area to thousands of miles away. So we see patients from all over the world.
Wonderful. So you're now at a position where you can sit back and relax, would you say? I don't think so.
Well, having additional two partners in the practice has definitely given me the breather that I can follow some of the other things that I would like to do, being able to exercise more, being involved in some non-profits. This was a vision of creating a non-profit for Gayatri Mantra and spreading the word of Gayatri Mantra was a dream of me, my dream 30 years ago. And finally it has come to fruition, and we're going to take it to another level. But clearly that gives me the time, and I'm able to spend a lot of time with the family, which I'm loving, and do exercise and do other things, running, which the love of running has clearly been there, and hopefully running another half marathon in January again, or February in Katy. And spending time with the family and kids and getting involved in school and giving it back to the community. So it has been an amazing, wonderful journey, and I'm very, very grateful to Houston. Houston has been an awesome city, and I see the diversity of Houston and what the Indo-Americans have done in Houston. It's a very, very proud moment for all of us.
Well, Houston is as awesome as you said, but it takes awesome people like you to make an awesome city. Dr. Suneja, thank you so much for sharing so much of your life experiences and how you've been such a part of the greater Houston area and contributing to the medical practice here. We're going to try to wrap it up over here. Do you have other things that you want to share with the people who are looking at us many, many years from now?
Well, all I can say is that even when I was training, as a child, I had a dream of becoming a cardiologist, and then coming to the U.S., a dream at that time, and practicing medicine and publishing extensively during my fellowship, and then practicing medicine, and I practiced with a passion. I would only tell the future generations, and I tell my children, and I tell students that I mentor at KTISD, and tell anybody, I said, you have to love what you do and do what you love, and follow your passion. Do anything. It could be medicine, it could be engineering, it could be anything in life, it could be art. You must follow your dream and work with a passion, and truly that is the most important thing. And I've been following my dream and my passion, and one day I do plan to write a book about my experiences in life, and that's what I tell everybody.
Well, thank you once again, Dr. Suneja. It's been a pleasure sitting here talking with you, and for those of us who will be fortunate enough to see this shortly through the Houston Public Library. This is going to be on their website. We're going to be able to see it there. And those of you who are seeing this many years from now, we want you to understand the role that physicians like Dr. Suneja have had in developing the medical community here in what we call our home, Houston. Thank you.
Thank you so much. Thank you.